welcome back to Instagram Live with me, Dr. Sunny Dhesi, and Viv. So we're continuing on our Thursday evening sort of weekly visit on ultrasound in aesthetics. So if okay, Viv's here and he's going to join us. So if I look a little bit bedraggled, it's because I've just finished in clinic. There we go. He's going to join us. So let's have a quick look. Go live with skin. Sort my hood out. Not looking too shabby after a full day in clinic. Although,
hi, Sunny.
How are you?
Fine, yeah. Not too bad. You quickly rushed to get it onto this live, haven't you?
I've literally just changed my hoodie, just sorting the hood out. Not that anyone wants to notice. So, no, we're joined by a few people already. So that's Dr. Vanessa Kubila joined, and Nagma from Team Cutis has joined as well. So I'll wave to you guys as you join. So thank you so much. So I was just telling everyone that as I was sorting my hood out, that we're restarting. We had a bit of a break. You were on holiday, and
yeah.
We'll learn a little bit more about. You've been a little bit unwell this week.
Yeah.
This week's ultrasound talk is going to be about Dr. Leonie Schelke. So a little bit of an autobiography Instagram live, I'm guessing, tonight. Or I guess we could call it mastermind. So you're in the mastermind chair.
Yeah, right.
Your specialist subject, Viv, is Dr. Leonie Schelke and her career in aesthetics. So
yeah,
why don't you start us off? So tell us, because we both found ultrasound. We both realised the importance of it in facial aesthetics to improve safety and effectiveness, and in time improve the efficacy of what we're doing in terms of injecting fillers.
Yeah.
And we looked for courses and things, and there are a few around. But what was it that attracted you to Leonie?
Well, I think we've mentioned a few times previously in our weekly lives, we're both members of a group of practitioners called CMAC, who are a collaborative group of medical practitioners around the world who specialise in complications and trying to minimise complications in injectable treatments. And about 18 months back, there was a live that they'd organised, and Leonie Schelke was in the live talking about ultrasound, completely new subject to me, but it was interesting to find out what could be done using that technology in the facial ultrasound arena, and how well it can be used in aesthetics in the work that we both do. So I was interested in what she was talking about. I'd got in touch with her, asked her lots of questions over the last 18 months, and found it really interesting to see how practically her work can be used in our own practice. And she really, I think, is probably the world specialist in facial ultrasound use in aesthetic practice. So Leonie's based in Amsterdam. She works as part of a group of practitioners called Cutaneous, who are based in Amsterdam. She also works in Rotterdam at the Erasmus Medical Centre, I think it's called, where she does a lot of research work, carries out actual practical ultrasound work on patients. And she sees patients from all around the Netherlands. This is what she's mentioned. When there's complications in aesthetics in the Netherlands, if a practitioner perhaps can't identify the problem or can't solve it easily, they tend to refer the patient to Leonie at Cutaneous. And she uses ultrasound to check the patient's anatomy, carries out vascular mapping, looks at what the problem is and tries to fix it accordingly. And she uses ultrasound to do that. So she's a specialist. She practices what she preaches. She researches and she trains as well. She carries out training around the world.
I guess that's the thing that really is different. You know, because what else does Leonie do? What else does she do apart from aesthetics? Just remind me, and tell the viewers as well.
I think she's her actual. She's a doctor. She's a doctor like
Yeah,
yourself, but she specialises in. She's a not a
phlebotomist.
phlebotomist, a phlebotomy. I can't even pronounce it. Sonny, the study of vessels, you know, the actual
Yeah,
study of vessels
yeah.
and anatomical vessels. She specialises in that. So I think she spends pretty much most of the time looking at the application of ultrasound in aesthetic practice. She deals with complications in aesthetics, but she's a doctor. She's a trained doctor, but she has chosen to specialise in the use of ultrasound in aesthetic work.
And it makes sense because that's what, you know, Viv and I have done sort of business training together and aesthetic practice management training together. And one of the things that you always get taught in this field is you've got to niche down. You've got to niche down because, you know,
Yeah,
before you kind of grow your business or grow your aesthetics client base, you kind of need to niche down and concentrate on one thing. And you know
yeah,
that's what is attractive about Leonie's work is that obviously her background is in, like you said, almost like a vascular doctor, not a vascular
yeah,
surgeon. So her
yeah,
interest in vascular anatomy has
yeah,
lent itself very well to facial aesthetics. And then obviously,
yeah,
you know, what is the main problem what is the biggest fear that we have is vascular occlusion
yeah,
or vascular spasm because
yeah,
of compression. And then who better a person that, you know, that's what I mean, she's not a vascular surgeon, granted.
yeah,
She's a non-invasive vascular specialist.
yeah,
And, you know, we're not going into the realms of, none of us are interventional radiologists, you know, that we can just suddenly whip out some imaging. But now
yeah,
what portable ultrasound has allowed us to do, and obviously following people like Leonie, is basically we have someone who's a specialist in their field. They've taken that specialist niche knowledge into facial aesthetics, into the very fear that drives
yeah,
us all, is that one day we are going to have a vascular occlusion, and therefore, who better person to follow than Leonie
yeah.
Schelke? So, yeah, go on. So,
No, it was just I was mentioning she's based in the Netherlands and she's part of a group of practitioners called Cutaneous. There's also her colleague Peter Velthuis, I think he's called, who probably doesn't get as much highlights on social media as Leonie does. But I think he and Leonie together work to research and carry out a lot of work looking at the application of ultrasound in aesthetic practice. Recently, just I think yesterday, she posted about a collaboration with Professor Sebastian Cortofana, who's an anatomical specialist in the area of facial aesthetics. And together, they've produced an e-learning course looking at the use of ultrasound around the face. So I think they've split it up into 7 areas of the face, and you can do an e-learning course with them online in your own time. So I think that's one of the things that she's posted about in her Instagram feed just yesterday. But I've been intending to actually go over to see her, and I was over in Amsterdam training with Tom Van Eyck just a couple of weeks back. I was due to see Leonie, but unfortunately she had some issues following Paris and IMCAS, so I couldn't unfortunately meet up with her. But hopefully in the future I will do. So it'd be nice to actually see her face to face.
I was going to say, didn't loads of people who went to, so IMCAS, for anyone watching, is a aesthetics conference in Paris. It was a big aesthetics conference, but I think a lot of people from there got COVID.
Yeah.
Yeah, and you're COVID positive at the moment. I shouldn't be laughing. I don't know why I'm laughing. You're COVID positive at the moment as well, aren't you?
I unfortunately tested positive on Monday. I think it's probably either coming back from holiday the week before or possibly when I've got back to the UK, I've managed to pick it up. So unfortunately, I've got a slight tickly throat, a little bit of tiredness, which is improving, but otherwise fine. I've had to cancel patients this week and move them into next week, but I'm still managing to do a live with you, Sunny. I wouldn't avoid doing that.
No, that's fine. That's good. You're a hero in my eyes. Okay, so we did put some slides up as part of our story leading up to this. So, Viv, one of the ones I think I really like the look of, because it's quite a few different colours, and hopefully you can. Leonie had done a pre-treatment CGI augmented ultrasound scan, dermal filler below angular vein. Have you got that one?
Ah, yes, yeah, that one. Right, I'll pop this up. I've got my iPad here, and you should be able to see what the scan was. So they only did a scan, scan of a patient, and this is under the eye area. And there was an issue with inflammation and swelling around the area under the eye. So the patient was seen by Leonie, and this is the scan she carried out. I augmented it, and this is how it looked after augmentation. You can see the blue area is a vein, and this is below the eye area. It's called the angular vein. The purple area is filler, and the practitioner who carried out the work injected close to the bone, but unfortunately it was under the angular vein. Now, if I just play that back again.
This is fascinating, guys, for those of you watching. Look, you've got a pre-treatment scan that looks like, a snowstorm. You can identify some muscle, you can identify the edge of the globe there. And then you've got the filler dissolution happening, and you can see that something's being prodded and poked. And is that filler? Is it muscle? And yes, there's a dark area above. But then with Viv's work, if you jump to the CGI augmented element, the vein is highlighted really well. It's blue, and then you've got that purple filler, and then that that needle going in. That, apart from, I've only ever seen that kind of element on cadavers, obviously, where we can dissect out. But to see that, it's absolutely fascinating, because you're really targeting that filler. So Viv, go on, talk us through your view on that scan.
That was one application of using ultrasound. Leonie saw a patient who was referred to her from elsewhere in the Netherlands, I think.
Do you remember? So do you remember the symptoms the patient had? Do you remember what the symptoms
I think there was. I don't know if it was a nodule, or there was some inflammation, or there was some lumpiness under the eye area, discoloration. There was a tint. I don't know whether the original practitioner thought it was potentially just a discoloration caused by the filler, but I think certain things may have been carried out by the practitioner. They may have tried dissolving.
Well,
might have been a few different things.
Just what you're saying there, if we reference back last week where we were talking about the Tyndall's effect, so those of you watching last week, I had injected some filler into around the buccal area here, and because there's there's no bone, it has to go quite superficial, and in certain lights it was showing up. And you see, without ultrasound, you can't identify. But from that scan, you know that it's not that superficial. It's just really close to that blue vein. So what could this patient be experiencing? As Viv said, it's lumpiness possibly, but actually if you've got pressure on a vein on venous return, then I'm guessing there is going to be some fluid, some lymphedema, some leaking from the vessel, and that's where you're going to get this swelling, recurrent swelling, intermittent swelling, and these are the kind of things that patients talk about when they come in.
And if the problem can't be diagnosed, if it's difficult to actually figure out what the problem is, fixing it is just about impossible. You don't know what to do. If it were to be a filler-related issue, you need to know where the filler is. The eye area is a very delicate area. The skin's very thin. There's a lot of structures in that area, and there's problems with drainage. There's lymphatics all around the eye area. And if you don't know where the problem is, fixing it is going to be very, very difficult. So what Leonie did was carry out an ultrasound scan, look to see where the filler was relative to the tissue, and she managed to find out that the position was below a vein. And by being in that position, the vein had lifted upwards closer to the skin surface. So the problem was there was movement of a vessel out of its natural position, which caused problems with fluid retention, with discoloration and lumpiness. And because she could identify the filler accurately using the ultrasound, she could fix it using guided ultrasound, using prescription-based material to dissolve the filler acculately.
So Viv, on that scan, I'm guessing, I mean, we're just speculating here. So I mean, that's not tear trough. That was obviously was it the lateral border? So near the lateral canthus. Where was it? The cheek? Was it where was it?
If you can see where she's scanning very close to the nasal bridge area, right? Yeah.
Yeah.
Yeah, so the actual, she may have moved around a little bit when she did the scan, but the filler was quite low down. It was probably close to the bone where it was placed, but it just happened to be under the vein, which unfortunately caused the whole issue. So I
was going to say, if anyone's wondering why there would be filler close to the nasal bridge here, and not, it could be that the tear trough filler was placed a little bit too low below the orbital septum, but it's probably that in that patient, what they were trying to do, and I'll lean forward into the camera, is actually just kind of create more anterior projection, so projection forwards, which is quite important in women. So nothing wrong necessarily with what they were trying to achieve, but you wouldn't know. Now, what can we learn from that? Viv, your lessons, what, I mean, in terms of placing the filler, what would you do differently, knowing if you were that person and you'd obviously, what would you do differently next time?
You'd vascular map for a start. As we keep saying, Sunny, the whole point of using ultrasound is to prevent a problem happening in the first place. It's easier to detect a problem should it happen. It's easier to treat it should it happen. But the best way forward is not to cause the problem in the first place. So if we were using our scanner to vascular map the patient before we actually start injecting, we could tell where the angular vein was in that patient. We could tell where the bone was. We could tell where the intermediate structures were. And if we could identify exactly where the filler would be best placed, we could avoid placing it under the vein. We may move to another area. We may say this isn't the best way forward using this particular technique. We may look at other options.
So one question I've got raised from that, though, for the naysayers out there, is that, I mean, the chances, I guess, of it happening are slim, but it's for us as, for even a big clinic, that one patient, you never want to cause a patient undue stress. But if I was looking at that as a case scenario again, and you were vascular mapping, obviously, I know the answer to this, but what mode would you use when you're vascular mapping for those? Just go through the modes again, because people don't know, if they haven't used.
Do you mean the actual types of settings on the scan?
So when we talk about vascular mapping, I'll say because I've kind of led you into a rabbit hole, where I'm sure I'm going. So basically, what I'm trying to just do is, for those who are joining who haven't, used ultrasound before, there's different modes that you can use, because you'd be like, well, if I scan there, it looks like a snowstorm, like it looks like something out of Siberia, like which is what. But actually, you can change the mode so you get a color flow. You're good at explaining this. So when you're on the color flow, what are you? If you're really good with anatomy, I guess you could probably identify a vein because it's a darker area. How would you use color flow to identify it?
You basically, before you do any Doppler is detecting flow, movement of flow, so blood vessels. You'd initially use what's called B mode just to look at the anatomy. You need to know exactly where the anatomy is before you start looking further and looking for blood flow. So once you've got your basic landmarks, you then turn on the Doppler and you would look for blood flow. So with a vein, the difference between a vein and an artery in ultrasound is when you squash the skin slightly with the probe, when you press a little bit onto the tissue, a vein will flatten, it will collapse down. An artery won't, it will still pulse at the same speed. So you can tell quite easily the difference between an artery and a vein. And that's what you'd use the colour Doppler for, to check the blood flow and give a little bit of pressure just to figure out whether it's a vein or an artery. You still want to avoid it, whether it was a vein or an artery, but you know by using pressure what type of vessel it was.
Yeah, no, definitely. So yeah, it goes back to vascular mapping. It goes back to knowing your anatomy. And you know what? I've sat with the anatomy book open and had the phone propped up, and I've just used the ultrasound. Because actually, I found that when I was doing cadaver training, it really cemented everything into my head, because it's so vivid and everything's very clear. But you know what? When you've got, why would you not sit? Oh, people make fun now, but why would you not have an anatomy book open? and
Yeah.
then go, well, that's what the picture is. Like, let's have a look what it looks under ultrasound. And you can learn this stuff yourself. You don't
Yeah.
have to. I'm not saying that we're sonographers, because we're
Yeah.
not. But what we are doing is just improving our technique. So I think we've got time for one more scan, actually. Viv, is there any
Yeah.
particular scan that you liked from that little library?
There was a few different scans. Like one of the simplest scan, the first scan that I augmented for Leonie, was actually showing how tissue moves, within the different layers of the face.
Have you got
So
that
this one,
on your iPads?
yeah, I'll show you this one. It was some work Leonie carried out based on research that was done by Professor Sebastian Cortafana again. I'll show you what the scan is. So this is a scan of, I think it's the mid-cheek area, looking at fat pad movement relative to what's called SOOF and the bone. Now you'll see the augmented version in a second. When you've never seen a scan before, it can be quite difficult to figure out what you're looking at. But I'll show you what the augmented version looks like. So the SOOF is the tissue low down. The superficial fat is the green area. When you make facial movements, the upper layer, the facial fat, slides around a lot more than the deeper SOOF, which is close to the bone. Now, what it shows is if you inject filler into a superficial fatty area around the cheek, it's going to move, and you don't want filler moving around because you'll see it in a person's face. So what that was really about was showing that if you can scan a face and use it to identify tissue, you can look at how relevant that is to injecting practice. And Sebastian Cortafana, he's done a lot of research in facial anatomy, and he's working with Leonie and Cutaneous now to produce e-learning courses for practitioners. But that simple demonstration gives an idea of where you should and shouldn't inject for efficacy. If you do facial filler injections close to the surface, you've got to be prepared for that filler to move around when the patient's face moves. That's the reason you would work deeper in the areas that are more stable, close to the bone. And that's what that demonstrated quite easily, I thought.
I mean, it's quite common, not common, but you see it now and again where someone has been doing cheek filler.
Yeah.
Even on a when we've done sort of anatomy training and you're injecting filler and you look to see where the filler has gone on a cadaver, it's actually it's still quite superficial. It's not always on the bone because you've got to press quite hard. And then obviously if you're doing it with a cannula, it's very easy, like you said, to slip into superficial fat, and then that's where you get, like, someone will say the filler's migrated up here because it's just going to slide upwards. So I think that's a really good scan. So I think we're just drawing. It's a nice conclusion, actually, Viv. I think some of that work you're doing. That's what really attracts me to the future of aesthetics. So obviously that's not done real time where you're doing the CGI. What do you have to do to add that in?
So with CGI, it's work I've been doing for a little while. It came about completely by accident. I'll tell you this story quickly. Last October, I asked Tom Van Eyck and Leonie Schelke if they would contribute to a Halloween video I was doing, and you did as well, I think, Sunny. And in that video, I thought it'd be nice to base it on Squid Game, the Netflix series. So I got some clips of you all, and I put them together in my own crazy way. But I also used computer graphics to manipulate the images. There's one particular scene in Squid Game where the main character has a biscuit and it's the shape of an umbrella. And I thought I'd turn that into a dermal filler logo. So I used some computer graphics to overlay it to look like something called Juvadum. I just made that name up for the purposes of the video. So because of that, I thought to myself, you know what? Could I use that for some other purpose? And I asked Leonie, could this work to augment your ultrasound scans? And she said, I've got no idea, Viv, but if you do it, I'll be impressed. So I tried it, and that last video that you've seen is the first video I augmented using that technology. It involves looking at an ultrasound scan, trying to figure out what layers you're looking at. It's not an easy thing to do, but if this could be done via artificial intelligence, it would be a fantastic way of providing education and training to practitioners and sonographers. But it involves using a computer to look at the motion of the tissue within a certain area, which I give that information to the computer. It tracks the tissue, it overlays it with colour, and the final image is based on using multiple layers of colour over one scan. So I've been doing that for a while with a lot of Leonie's images, and she's quite astounded by what can be done with that technology.
It's pretty amazing. I mean, that would be amazing, couldn't it? If you could scan the AI overlays CGI on top of it, and then then it's color coded and you can see. So there's a really good question actually from Fern Aesthetics about would you not recommend injecting the cheeks with a cannula then? No, I mean, I personally use boluses, but you know, when you're trying to get a nice hemispherical curvature, a natural curvature from anterior projection all the way lateral, it's quite hard to do it with boluses because you have to do a lot of injection points. And you know, my clients they'll get a really good result, but they'll just sometimes say their cheeks are, their cheeks are a bit sore. I think what we're saying, or what I sometimes see is that I actually struggle with it still, is that how deep do you go onto the bone with a cannula in order to get that nice projection? Now, with a really projecting filler and an easy glide, like a cannula goes in quite easily, it's fairly easy. But I think for me, it's where the filler is exiting the cannula, like where is it being deposited? Because you need, if you're trying to, the way that I always do is, if you've got a long, thin corridor, you're looking down a corridor and you've got like foam that you're trying to spray down it, but then the corridor keeps changing shape and doors are opening. Then it's like some sort of maze is going on. But where you're coming from the top with an 90-degree angle injecting. So I would say that there are a lot of really good practitioners, and I've seen it on Instagram, I've seen it in clinic as well in practical terms, where they will use a cannula really well and fanning it. But I guess it's that neuro programming that you recognize how deep your cannula is, and I think that that's where ultrasound has a place, because if you I mean, it's hard enough to inject with one hand as it is, but if you have someone place the ultrasound over the top, not compressing too much, and then you were to slide your cannula in, you'll be able to judge where you are quite easily.
It is one of the practical problems of doing something like a guided injection. I'm still trying to get used to it. It's not easy. And I think probably it would be easier having somebody else with you if you're doing a guided injection, purely because it's difficult to hold the needle and place it in a certain depth of tissue using just one hand. If you've got one hand,
I guess what you could do though, Viv, I mean, look, there's a lot of good practitioners there who do cheek. I mean, I did Dalby Humza's training, 2 years ago, where it was all cannula based, and even now I'll still use a cannula in the preauricular space and then just underneath the zygomatus. But basically, some people are really good at defining the cheeks. But my worry is, like we've just discussed, is that I'll go too superficial. But I guess you could use the ultrasound to find your depth. And then just take the ultrasound away, and then you're in the right place. But
it's a bit of practice. Like with the ultrasound, you can measure depth, and you can look at what sort of depth you need to be at to actually hit the bone and work at the deep tissue layer. But it takes time and it takes practice to do it. And as we've said, if we can vascular map, we can identify potential issues before doing an injection. That's the way forward.
Yeah, no, definitely. I think, in answer to your question for anesthetics, I mean, no, I would still recommend doing it with cannula, because there's things you can do with a cannula that you can't do with a needle. I think it just depends on training. For most of us injectors, it's all about practical element. The more you do, the more depth you have. It's just like, when you, as a doctor and a junior doctor or nurse, when you're in hospital, the first time that you cannulate a vein, you remember it because you're so ecstatic. Obviously, in aesthetics, you don't want to cannulate any kind of result. So, but that popping sensation going through connective tissue, getting down to bone, I guess what we're saying is that nothing is ever the answer. It's about bringing different elements together to innovate and produce the result that you want. But if anything to add, we've come to our time.
No, as we've said, Leonie's a really nice person. She's probably the world's specialist in this area of practice using ultrasound in facial aesthetics. And she, hopefully, we'll hopefully both meet her up at some point. But there is a lot that can be done using ultrasound, and these are just a couple of examples. There's also other areas like guided toxin, which is something that she works on. But I would recommend following Leonie, facial_ultrasound, and Cutaneous as well. There's a link on her bio page to go to the website for Cutaneous. But if anyone's interested in aesthetics, wants to know just how much work goes into using ultrasound to detect problems and try and fix them, follow Leonie. That's what I'd recommend anyone to do.
She's got Cutaneous, a good website, and obviously also on Clarius as well. They have lots of little training videos. So there is a lot of cases involving the use of the Clarius scanners. So certainly I'd recommend looking at the Clarius portal and do search, do type in a few searches on Instagram and Google, facial ultrasound, and YouTube as well. Our videos are actually in a series on YouTube. So if you want to look at them, have a pop over to YouTube. You'll see all of them in one place. So just for anyone joining now, is that today we were discussing the work of, is Schelke, how do you pronounce it, Schelke or Schelke?
Sorry, what was that? I pronounce it as Schelke, but it might be Schelke. I'll have to ask Leonie, to be honest. I never actually bothered finding out. I assumed it was Schelke.
So today we've been speaking about, obviously, Dr. Leonie Schelke's work. It's someone that we would recommend following. I think we've just had someone that follows us and follow Ultra Sanando too. Ultra Sanando, okay, yeah, we'll follow you too, Ultra Sanando. That's someone who joined us.
Right, okay.
Yeah, someone that specialises in ultrasound as well. And Fern Aesthetics, yeah, no problem at all. But yeah, in answer to your question, so she's just saying, thank you for answering my question. I also like to use needle to bone for the lateral part, but like to fan with a cannula for the mid cheek for projection, but I certainly don't go deep. Yeah, no, I mean, if you're getting a good result, that's fine. I tend to go deep with the injection, and yeah, Ultrasando is a radiologist. Yeah, we'll definitely follow you. But thank you for also watching our.
That's Rosa. I know Rosa. Rosa Secrets.
Okay, you know Rosa. Okay, fine.
Yeah, I know Rosa.
It was Viv. He's a bit ill at the moment, so he didn't recognise you.
I am, yes. Apologies, Rosa.
Yeah, definitely. We'll follow you, Rose. Well, I think I already follow you, and so does Viv. But anyone else watching, please follow Rose as well. She's a very good radiologist from Brazil, which Viv has mentioned. So, Viv, just very lastly, so just in summary, Dr. Leonie's work, definitely follow Rose as well from Ultra Sanando.
Yeah.
Fern Aesthetics, no prizes, but thanks for interacting. We love it. So, you know, we do like comments. And we did actually have a comment from, you had a little compliment there, Viv, from Hilltop Aesthetics, because they liked your Juvederm.
Oh, yeah. Well, I have my jokes now and again. It was on the Halloween video last year that I posted.
Brilliant. Okay. I'm going to grab some dinner.
Yeah.
You get some rest, and see you next week.
Yeah, we'll come up with a different topic, or if anybody has any ideas, please let us know.
Yeah, please let us know, because these are the sort of questions we want, because it makes us think about what we wanted to present. Brilliant. Thanks everyone for joining. Good night.
Thanks, Sunny.
Bye bye.
See ya. Bye.